I'm not sure what John said to everybody to have you agree to have me come. I heard that people were excited about talking about erectile dysfunction, which I was surprised to hear. Oh yeah?
I don't think so. Maybe John was asking.
Well, that's certainly one of the things that I treat and that I've had a lot of success with. It's not the only thing. I want to talk about what you guys want to talk about. So I'm not here to give you some scripted nonsense selling my acupuncture clinic. I want this to actually be something that's worth your while. So my name's Dr. Olivia. I own Pike Acupuncture and Wellness over in Milford. I've been there for about 4 years. And I've been in the field for over a decade. Believe it or not, I started right out of high school. So while you might be thinking, who is this young 30-something woman, how could she tell me about men's health for my age? How could she possibly understand? I've been treating guys like you for, my entire career. Helping you get out of pain, help with nerve damage, and other men's health issues like ED, like prostate issues. Really, people come to me for everything under the sun because people come to me last. Who thinks of acupuncture? When trying to help your erectile dysfunction, or if you're taking too many trips to the bathroom, people really have to go through every other specialist to finally try what seems like voodoo medicine, and then they often get the best results. So I'm wondering, who's the youngest guy I have here? Yeah? How old are you, Frank?
62.
62, okay.
Well, I'm 63.
You're 60.
Oh,
Okay. Fresh as a daisy, in my opinion. 57. Going for 57. Who is the oldest I have here? How old are you?
I'll be 83 next week.
83? Nice. So age ain't nothing but a number when it comes to acupuncture. It is never too late to feel better. It doesn't matter how old you are. Sometimes even my patients in their 90s have had some of my most miraculous success stories. I would say someone in their 80s who's got a great attitude, who is active and has, hope that they can get better, they have better results than even somebody in their 20s who's kind of a Debbie Downer, negative Nancy, who, eats terribly and, stays up all night. So don't think that your age is a factor. Now, I know people were excited about erectile dysfunction. That's what I heard. But I don't want to concentrate on that if that's not kind of the overwhelming majority's, desire to work on. So, can you raise your hand if that is...
So tell us
yeah.
what acupuncture does for some of your major issues when people come to you and what it does.
So people come to me for everything under the sun. Okay, so I specialize in chronic complex conditions that people have come down the entire pipeline of Western medicine before they come to me. Like people who have had, lower back surgeries and then have nerve pain down their legs. I see a lot of that. I have great results with that. Also peripheral neuropathy, which is very common in seniors, numbness and tingling, pins and needles in your feet and legs. Then your run-of-the-mill arthritis, back pain, really everything. I get a smorgasbord. So the way that it works in different ways depending on what it is that you're coming in for. But what acupuncture does is that it has a very profound regulating effect on all of the body's systems. If something is out of balance, it helps to bring it back. That can be someone that has severe anxiety, depression, helps to bring them back down to earth. That can be somebody whose, brain is just constantly sending pain signals from the low back. I've had people with asthma, COPD, really everything. So I can be called a generalist, but where I really shine is these things that are nerve damage in nature, chronic, complex. Now, raise your hand if you were very excited to hear me talk about ED today. Yeah, thank you for your honesty, sir. Because I prepared a whole presentation for that.
They're liars.
They're liars. Okay. So the first thing that I'll say about that is that no, the needles don't go where you think they're gonna go.
Whoa, I'm glad to hear that.
Yeah, no, there are no needles in the penis at all, ever. Don't ask. But there are many different underlying causes of ED that I can help with. Yes, it helps with blood flow, but so does Viagra. But you know what Viagra doesn't do? It doesn't help to calm down your nervous system. And if you've been dealing with ED, you know that you're constantly worried that it's going to happen. And then that worry causes your performance to decline. So it helps to change the way that your brain is perceiving it. After a while, sex kind of becomes a threat where you're so worried about your performance that it doesn't work. It helps to, calm your nervous system down for that. While also, yes, improving blood flow. Yes, while improving your stamina and your energy levels, but it's multifaceted. Yes.
So, let's assume you have a patient coming in, somebody that comes in, and they tell you about 1 or 2 or 3 things that bother them. From what I'm hearing, prior to the ED thing, is that you focus more on making sure that all the organs in the body are working properly, that the nervous system is sending the proper signals to keep things in balance.
Yes.
So I come in, I tell you, I have a lot of neuropathy, ED, whatever, right? You take this approach like, I just want to reset the body in general, or you're dealing with a specific issue?
So it's always best to have the top 1 or 2 conditions that are most important to somebody, just so that we can hit a bullseye on that and not try to work on so many different things at once. So while that is important, I can't help but to help everything that is going wrong with the body at the same time. I've had people whom I'm treating for peripheral neuropathy, and then they tell me a couple of weeks in, Doc, I didn't even tell you I had constipation. My lifelong constipation is better. Just because of how it gets things moving in the body, helps calm people down, and get you back into balance. So yes, I do want to focus on 1 or 2 very important things to the individual, just so that, I'm taking care of what's important to them. The whole body tends to get more into balance after that. Yes, sir.
Does Medicare pay for this?
So the short answer is no. Unfortunately not. I lobby every year to try to get it to be covered because the vast majority of my patients are Medicare age. They put in a stipulation this year that says that it covers, but it truly doesn't, because there are just so many factors that need to be present in order for them to pay, that it's just, they don't, unfortunately. It depends on the insurance company. Yeah. But the best thing about acupuncture is that while it can be pricey at first, it's far less expensive in the long term than dealing with other health issues. So across the board, if somebody's been dealing with something very serious or chronic or both, they're going to need more treatment in the short term, but it actually changes the body's function over the long term. So in the beginning, I may need to see somebody 2 or 3 times per week. As they get better, they need to less and less and less until they are coming as infrequently as humanly possible, like once every 6 weeks, or they're just coming in to ride in and say hello. I have a 93-year-old patient who is now completely pain-free. His name's Edmundo. He's the sweetest guy in the world. And he just rides his bike into the clinic once a month, literally just to say hi to us. He just doesn't need care anymore. Now, that isn't the case for everybody. Some people need some form of maintenance depending on what's going on with them. But the great thing is that you need less and less over time. So while it can be more of an upfront cost that can be prohibitive for some people, we do offer financing methods that make it easier. And truthfully, it's just well worth it. Because people tend to come to me after trying everything else, and the alternative is just, guess you're gonna have to live with it, which I don't accept, personally. Does anybody else have something that they would love to hear about?
What about smoking, acupuncture?
Yeah, so I've been very successful with acupuncture for smoking cessation, acupuncture for addictions in general. Just like it helps to rewire the body to be out of pain, it also can rewire the brain to be out of addiction. Now, for some people, this can happen quickly if they're already making the identity shift that they're no longer an addict or a smoker, and then we just treat them for the withdrawal effects. For some people, it takes more of a few months of kind of gently making those changes and reducing the amount of cigarettes that they're smoking over time. But depending on the method that works for the individual, I've been very successful.
Why are you looking at me?
You're the closest. You're the closest.
There's probably two guys that smoke. There are two guys that smoke in this whole club.
Yeah, yeah. Yes, sir. Heart failure. Well, so it depends. I would definitely want to be in communication with the person's cardiologist, if it's your cardiologist, to see where you're at in the process. If you've been told that there's nothing more that can be done, that they're just going to have to monitor you, that you have to be on medications forever, watch your diet, I would help to support the body in that process by helping to improve circulation, to to help you move and to help to support your goals of like eating healthier, of reducing your stress, all of these things that can contribute to, heart attacks down the line. It's more of a whole body, support approach when it comes to heart failure. I can't really like reverse it.
How about the people that
I have to help them get out of the high risk category. So does that mean helping them lose weight? Does that mean helping them quit smoking or quit drinking or getting them out of pain so that they can finally exercise again? There are lots of ways that we can help somebody to reduce their risk, and I can help to support in more of a holistic way. Yes, sir?
How about reducing arthritis or inflammation?
Oh, absolutely. Absolutely. That's one of the most common things that I treat. It's very effective. It works in the same way. It helps to change the way that the body is processing the pain signals. Yes, you put needles locally and helps to reduce inflammation, and that's nice, but lots of things do that. The way that acupuncture really excels in that is that it trains your body to not respond to the arthritis as much, while we help to heal, whether it's your shoulder or your knee. Over time, we can help to reduce inflammation and actually support the regrowth of tissue and cartilage. That takes time, but in the meantime, it trains the brain to be less responsive to the pain signaling, and then we can also help to support the surrounding musculature to help, lift up and improve strength. Yeah.
Is everything the placing of needles? Is that what acupuncture?
Yeah, so acupuncture is placing very fine, sterile, single-use needles into very particular spots that help to stimulate muscles, nerves, or both, to help change the way that the signals are coming from that area to the brain, and vice versa. And also, I do much more than just acupuncture too. Different forms of electrical frequencies have been shown to be even more helpful than acupuncture at helping to regenerate tissue. So I like to combat, especially arthritis, from different angles to get the best results possible.
Olivia, it doesn't help with weight loss, does it?
It can if you're doing everything else right.
Okay.
Now, it's no substitute for, not eating pizza, for example, of which I'm guilty. But if someone is, doing the right thing 80, 90% of the time, and it's just not coming off, by helping to reduce inflammation, by lowering cortisol, helping to relax the nervous system, and then if there are any barriers to exercise, like chronic pain or weakness, nerve damage that are stopping somebody from working out, that's how I can help in weight loss.
Okay.
It can help to kickstart metabolism if everything else is part of the puzzle pieces. Yeah.
What if you're on prescriptions that cause ED? Can you help with that situation?
I have seen success with that in the past, but it's more successful if we can help to lower down the dose. It depends on the medication, and if it's possible to lower the dose. If I can help to lower the dose using acupuncture to help the symptoms that this medication is being, given for, then yes.
You would have to be constantly checked, your blood or whatever.
Yeah, ideally you would have to work with your doctor to see if it's possible for you to get on a lower dose of that medication. I have had some people be very successful with without changing their prescription, but sometimes it's not possible. Sometimes that's truly the root cause, and we have to take care of that root cause by helping you get on a lower dose or getting off of the med. But sometimes it could even just be, ED is multifactorial as well. It's not just a medication constricting the blood vessels. It can also be psychological. It can also be, just lacking in energy. And when you boost up somebody's energy, help them to relax, help them to feel like safe, that sex is safe, that makes a huge difference as well, even if you can't get off of the medication. But sometimes we do want to help you get off of the medication whenever it's safe and possible. Yeah?
Is there anything that can be done about high blood pressure?
Yeah, absolutely. Absolutely. Especially electroacupuncture has been shown to be extremely effective for reducing blood pressure. I have some patients who have completely gotten off of their blood pressure meds using acupuncture. Yeah.
That's impressive.
Where, Olivia, did you get your training?
So I went to a school called Acupuncture and Massage College in Miami, Florida, which is where I grew up. That was a 4-year combined bachelor's of health science and master's of oriental medicine. And then after school, I went to China and I did a postdoctorate internship over there, where I went to one of the best integrative hospitals in Shanghai. And I learned from some of the best doctors, and I got to shadow them for 6 months. That was an incredible experience.
So I have a question over. So,
Yes.
you know, at our age, right, most of these guys probably have multiple issues going on, and they're on medication and stuff like that. So is the first one like a consultation, you come and say, all right, here's all the meds I'm on,
Yeah.
here's some of the issues, and then how do we figure out?
Yeah,
where we go from
definitely.
there?
So we start out everybody with a totally complimentary consultation where you can speak with me about what your goals are, show me your medication list, so I can hear the whole story and how what's going on is impacting your life. And then I'll give it to you straight and let you know what it's going to take in order to get better, whether that'll be acupuncture or a combination of acupuncture and herbs, what the titration of medications could look like with the support of a doctor, and then you can begin.
All these guys have a lot of money, so it's not fun.
Can you take care of multiple issues at one time?
Yes, I can. It's important for me to know what's most important so that I can put most of the energy into that to make sure that you at least get the most important thing to you taken care of. But I can't help but help other health conditions as I'm treating it simultaneously. Both because of my heart, because I'll never hold anything back in treatment, but also because so many issues are interrelated. So that when you help the body get back into balance, all of these things gradually start to get better. Yes, sir.
Does this help with alcoholism?
Yeah, just like it's the same treatment for quitting smoking. Needles go primarily into the ears, and depending on your goals and like what your temperament is, some people are cold turkey people, and they feel like that's just the best way for them. Otherwise, they're never going to do it. If that is your case, it's best to kind of treat acupuncture like outpatient rehab. To come more frequently within the short term to help with the cravings, other withdrawal symptoms. For some people, it's more of a longer term identity shift that needs to happen, where you're using the alcohol to cover up stress, anxiety, depression, pain. So taking care of those root causes, as well as over time helping you to feel like you're the kind of man that doesn't need to do that. I've been successful.
What about sleep issues?
Yeah, definitely. Truthfully, acupuncture has a treatment for everything. I can help everything. I would say that the vast majority of people that come into my care get better, like 90% plus, because it helps the root causes of pretty much every illness. If you are resting well, if you're feeling like your environment is safe, if you're in less pain, you're going to the bathroom regularly, the body naturally wants to be in balance. And it's going to get there. It's like nature. If you leave it alone, everything is going to start coming back. Same thing.
They had two people quit.
Can you talk about your fees?
So I can't really talk about my fees because my fees are different for everybody, and I think that that's one of my strengths. People come in for a complimentary consultation. Everyone's case is truly different. Now, if you have something that's been going on for a long time, or it's very serious, it's going to take longer, and that's going to cost more. So after having a comprehensive consultation with somebody, I can let you know how many times I'd like to see you per week in order to make it happen. Ideally as fast and as cheaply as possible. So if people can come more frequently in the short term, they're going to need less care in the long term. And so my goal is to give someone a plan that's going to get them as better, as fast as possible, as inexpensively as possible, as pleasantly as possible. So that's usually somewhere between 2 to 6 months of more intensive care to meet their goal, and that costs, it really depends. But for most people that have gotten to the point where they need my care enough, it's in the thousands. but it's different for everybody, and we have payment plans to split it up. Yes, sir.
You know about occipital neuralgia?
Yes, I do. Occipital neuralgia is a gnarly bastard.
It's a, I don't want to say what it is.
Yeah, I have worse words for occipital neuralgia than gnarly bastard, but that's the cleanest that I can come up with. I have had great success with it, but it's something that is so terrible. It definitely takes a few months to resolve, but I have several patients right now who are on their maintenance phase, coming less and less frequently, once a month. So in the beginning, it takes longer, and it's something that definitely goes up and down, but very oftenly gets better. I have about a 92-ish% success rate with ON. It just depends on my caseload at the time.
I've had a nerve ablation, and I'm just getting one right now.
Well, sir, I hope it helps. Most people come to me after the multiple nerve ablations that don't help.
That's what I'm thinking. I got 4 months out all last month.
Yeah. They tend to have diminishing returns, those shots. Sometimes they can be miraculous in the short term and get people out of a really sticky situation. Other times they don't work at all. Again, people tend to come to me last after trying everything else because it's still considered kind of voodoo medicine. At least that's what I thought before I tried it. Any other questions?
Yes.
Yes, sir.
You have any patients that you treat that have MS?
Yes. Now I'm saying I have great success with everything. I kind of do. I know it sounds unbelievable, but yes, I've had several patients with MS in the last couple of years who have done very well. The root cause of MS is Epstein-Barr virus, according to Harvard a couple of years ago. And I have therapies that help to rid the body of chronic pathogens like that. So I have good success with MS, like chronic Lyme, long COVID. I treat them all in very similar ways of helping the body to regulate the immune response, kill that pathogen, and then overall get out of pain and slow the progression of it. It's one of my favorite things to treat because people have just been told that they have to live with it and that it's just going to get worse and worse, and I have not found that to be the case. Is that you, or? Yes, sir.
Oh, no. Can you
Memory
keep that-
loss?
Memory loss.
Yes, I can. I find that a combination of multiple therapies, specifically herbal medicine, has been shown to be very good with treating memory loss. Yes, there are needles that I can put on your head to stimulate blood flow, but the research shows that herbal medicine works the best for it, of helping to slow it down, helping to oxygenate the brain. But I like to tackle it from multiple angles. There are also lots of different causes of memory loss that we have to investigate and see what that could be. And so those have different treatments as well. But I have seen success with it. My mom will not let me go a week without treating her for it. It's been very helpful.
Thank you.
Yeah. Anybody else?
So you're gonna stay for our meeting, right, so that if anybody wants to have a
Yeah.
conversation with you.
Sure. I think I have one more question, but
Oh,
we'll
I just
definitely
wanted to know
stay.
where your office is.
Yep, it's in Milford. It's in the Ed Nichols building, if you're familiar.
Oh, yeah.
It's off of the 3-lane.
Right next to the Blue Ridge building?
Yep, right next to the Blue Ridge building, and next to Myers Motel, if you're familiar with that.
The Nichols building is a construction fund, right?
Yeah, they are home builders.
Yeah.
Okay. Thank you so much for having me, everybody. I did want to mention one more thing before we. I have a lot of experience with this age group and men in particular, and I have found that it's a very hard time emotionally. You've lived your lives for a long time, ranging from 60 to 83, and your bodies have carried you through a lot. And society tells men that you just have to suck it up and be a man. And, you've been the providers, the protectors of your family for so many years. And I have patients who would rather die than hire, a 20-year-old to mow their lawn. But as you get older, it becomes a little bit more difficult to hide, your struggle. And people's biggest fears at this age are becoming, a burden. Becoming not needed anymore, and then having to rely on their family members for care. And I just want to let you know that you're not weaker for asking for help, that you still have lots of years left of taking care of your family, and there is a way to turn back the clock a little bit. Maybe not to 40, but perhaps to 55 for most of you. People tend to have a restored sense of vitality that lasts. So call me. Jackie will be here, as will I. We'll both stay until the end of the meeting. You can schedule your complimentary consultations just to speak with me, no pressure, for about 15 minutes about your care and see what it's going to take, okay?
Do you have any handouts or anything?
Yes, we do. We have cards. Yeah, and then we
My
have.
wife is more interested in that.